Brought to you by DentalImplantsGuide.com. Best online info.
Okay, this is going to be a presentation on the MIS-Mistral implant, which is a Morse taper internal octagon from MIS Implant Technologies. The Mistral implant is made out of grade 5 titanium alloy. It is actually alloyed with aluminum and vanadium, which basically helps to improve the strength of the implant by 25 to 30%. It also helps with the corrosiveness of the implant. The implant itself is actually Morse tapered internal octagon, which has a little bit of play of 8 degrees on each side for a total of 16 degrees with the conical within the conical. Like I said, it is a Morse taper internal octagon, which is actually compatible with the Straumann ITI system. Within the thread design of the implant, it is a very aggressive implant which has 3 cutting channels on the bottom of the implant. It has a domed apex, which when you're working in the sinus area will help to reduce perforation or reduce the possibility of perforation of the sinus. The initial stability, again, with 3 bone channels on the sides that are gathering bone chips, because this is a self-tapping implant with 3 cutting edges on the bottom. So as you're placing that implant, it is actually going ahead, it's cutting the bone, and the bone chips are then being gathered on the side of the implant, and again helping you with getting a great initial stability. As I mentioned before, the implant is a grade 5 titanium alloy, which again alloyed with aluminum and vanadium to help make it stronger and more corrosion proof. There are 3 spiral channels running the length of the entire implant. And again, that's going to help with your initial stability by gathering those bone chips in those channels. One of the best features of this implant is actually the fact that as you go from the apex to the neck of the implant, you're actually getting wider with the channels. You're going from about a 0.2 all the way up to about a 0.3, which as you're placing the implant will help to compress the bone. Another great feature for initial stability as well as for secondary stability are the micro rings at the neck of the implant. Basically what these are doing is they're getting more surface area on the implant, so there's more surface area on the implant, so with the initial stability you have a better grip into that bone. And when it comes to secondary stability, you have more area for those osteoblasts and osteoclasts to really grow in and do what they need to do. In talking about the osteoblasts and osteoclasts, let's talk about the surface area of the implant and the surface treatment of the implant. The implant is large particle blasted and acid etched. What this helps with and what this does is essentially it creates both micro and macro pores on the surface of the implant to again help with the secondary stability, where again you can see the micropores and the macro pores to help the osteoblasts and osteoclasts really get in there, get down and dirty, and really do what they need to do to help that secondary stability and really osseointegrate really well into the implant itself. All in all, it is a fantastic implant. The implant itself also has a 2mm polished collar with a beveled edge that is about a 0.4mm at the top of the implant. What that does basically is help you with the platform switching. When it comes to the prosthetics on the MIS Mistral, there are several different options that you have. The first of which is a solid abutment. The solid abutment is available in 3 different heights. It's available in a 4mm, a 5.5mm, and a 7mm as well. The maximum angle position for this abutment is 6 degrees on each side. It's specially designed for the platform for the 4.8mm. It also comes with, the Mistral itself comes with an impression coping. It comes with an abutment. It comes with a plastic healing cap, so that is meant as a one-stage implant. It can be used as a 2-stage if you'd like by removing the abutment, but it is meant as a 1-stage. Once you place the implant, you go ahead and place that impression coping. Go ahead and take your impression, and then you'll put a plastic healing cap on it. You are also able to get with that solid abutment. You get 2 burnout caps, either engaging or non-engaging, depending on whether you're doing a single or a multiple case. Again, coming in 3 different heights. There's an entire kit actually that comes with it. You have different options when it comes to your analogs. You can either get a solid abutment analog. There's also the option to get just a regular analog, but when working with the solid abutment, probably going with the solid abutment analogs is your best way. This little video, the short video, will actually just show it turning in, going ahead and taking the impression with the impression cap. Once that comes off and is in the impression, you're then going to take that abutment analog, and you're going to place that in the impression and match it up. Again, very, very simple procedure. The burnout caps are then added and cut down to the appropriate height. They have 3 different lines for 4, 5.5, and 7 millimeter. The crown is then fabricated, and then you're ready to go ahead and restore it. And it's a very, very simple procedure. The second option that you have is the direct anti-rotation. Basically, this abutment is available in only one height of 4.2 millimeters. Again, it's also designed, the Mistral implant only comes in one platform. It actually has 3 different sizes of a 3.75, a 4.1, and a 4.8, but it is only one single platform. The maximum angling on this abutment that you can have is going to be 3 degrees on each side. We do have a kit that comes with the 2 burnout caps. Again, one for engaging, one for non-engaging. And then you also get the healing cap. This actually comes with the implant itself as well. You have that healing cap, which is great for after you take that impression. You put a little bit of cotton cabot inside the abutments. You put the healing cap on with a little bit of Tempon, and the patient goes home, and they're basically finished until that crown comes back from the lab. The abutment it has an octagon which engages with the octagon inside the implant itself, and you have actually 8 different directions in which you can then go ahead and turn that implant. Or I'm sorry, not that implant, but that abutment. Again, these are all the options that are available. If you're not gonna prep this abutment at all, the abutment analog is absolutely perfect for a case like this, where basically the lab, all they have to do is just cast it up. It's an exact replica of that abutment on top of the analog. If you are going to prep it, what you can do is just get a regular implant analog, take an implant level impression, and go straight from there. Again, here's a small demonstration on the restoration using the direct anti-rotation abutment. Screw goes in, gets torqued down, plastic cap goes on, just making sure the margins are even. The impression is then taken. The abutment analog in this case is then put into the mold. The plastic healing cap is placed on the abutment. Patient goes home. The lab then goes ahead and casts up the crown using either the engaging, in this case, or the non-engaging plastic burnout cap. Cast the crown, the plastic healing cap is removed, and the crown is then placed on the abutment, and the patient is happy, and the patient goes home. What's included with the Mistral implant, as I said before, is going to be a direct anti-rotation with a 1 millimeter collar, not the one that you just saw, which doesn't have any collar, but it does have a 1 millimeter collar on it. It's also, you have the plastic impression coping, you also have the plastic comfort cap, as well as the final drill, which is included in all of our Mistral implants. With this abutment, again, you get that healing cap, you get the impression coping, and then you have burnout caps if you need them. Either abutment level, implant level analogs, or an abutment analog, again, which is an exact replica of this abutment on top of the implant itself. If you're doing an overdenture case, we do have ball attachments that are also available in different heights. I'm sorry, it's actually only available in one height. 2.6 millimeters is only the ball. It's a standard ball screw diameter of 2.25 millimeters. Again, there is one platform on the Mistral of 4.8 millimeters, and so this is appropriate for that. And there are different caps available to use with it. And again, these are you either have, I believe this is a gold one, and you also have the plastic. You have the ball attachment abutment, and then you have the key in order to be able to torque it down. Again, another short demonstration on how it goes in. You actually will turn that in with the key, and then you go ahead and cold cure the plastic caps on top of it for that case. If you want to use an angulated instead of one of the direct anti-rotations, we do have an angulated as well. It either comes in 15 or 20 degrees. Again, it's for the one platform of the Mistral that we have. It is available in 5.8 millimeter height case for you. Thank you very much, and we hope to hear from you soon.
Brought to you by DentalImplantsGuide.com. Best online info.